Located on the Caribbean coast of Central America, Belize is a unique country of important geopolitical and historical significance, wondrous natural beauty, and vibrant, diverse cultures. A significant proportion of Belize's population is young. About 48% is aged 19 or under. And while Belize is considered a middle to high income country, the gap between poverty and wealth is significant.
The alleviation of poverty would in fact increase access to better education, to better health, making people more productive, having us developed into a country that would create happier families, happier children, a better productive community.
UNICEF's agenda is very much focused on the issue of equity, trying to see how we can reach, not just reach, but save children who are most disadvantaged.
The United Nations Children's Fund, UNICEF, is committed to working alongside the government and people of Belize to support the ongoing efforts to create the environments that foster positive developmental outcomes.
We look right now a lot at social policy and how to shape a policy agenda and a dialogue with government and with partners that could foster, let's say, evidence-based policies for children, and really try to take us forward in a way that will result in a highest possible level of social well-being for boys and girls in Belize. Poverty alleviation is the key. It is really the underlying issue to many of the other challenges that children face.
A situation analysis of children and women is a central function of UNICEF's mandate and a major tool for informing policy dialogue and child-focused policy advocacy. The Satan harnesses the involvement of government and civil society at all levels to help build ownership of the findings and harmonize policy reforms. The Situation Analysis of Belize 2011 identified a number of stumbling blocks that hamper the proper development and the positive social well-being of children, including malnutrition, the underreporting of birth registrations, inadequate sanitation and hygiene practices, and a lack of access to quality early childhood education and development. Only 10% of Belizean babies are exclusively breastfed for those first crucial 6 months, leaving the majority without the protection breast milk provides.
Our highest population of mothers giving birth are teenagers, and cultural belief is that the breast will sag. Some mother thinks that because they go home, they have to go out to work, they don't have the time, or they cannot breastfeed because they will not be able to breastfeed after going back to work, which is not so.
You know, breast milk contains nutrients.
In response to the situation, the Ministry of Health, the National Committee for Families and Children, and UNICEF have teamed up on the Baby Friendly Hospital initiative to promote the benefits of breastfeeding to both mother and child.
For the baby, it causes a healthier baby. We have the mother will, again, economically spend less money at the doctor for things like diarrhea, vomiting. It causes the baby to be a smarter child. The growth is more normal. It's the first immunization for that baby.
When we look at our overall statistics and our population, we have a very young population. So if we're looking at children under 5, and we have a large percentage of them being malnourished, it's scary to think about what will happen as these children grow.
According to the latest studies, malnutrition and diet are important issues for children under the age of 5. Statistics show that stunting due to malnutrition affects 1 in every 5 Belizean children. That figure doubles in some Maya communities.
Stunted growth or stunting refers to low height for age. Okay, and that is very indicative of malnutrition. So once the child has reached the age of 3 years and the child has not been or has low height for age, the child is stunted and it's irreversible.
Root causes to the situation include a lack of access to health facilities, especially in rural areas of the country.
We need to have more accessibility for people in the villages, so the problem could be reduced from that area. Because if you live in a city, you can easily, the clinic is there. Once you know what to do, you can get there quickly. But if you live in a village, and there's some villages that are very far, so we need to have more services available for those people, and that's what we have been working on. We have tailored a lot of our efforts to go more into rural and more growth monitoring, especially that, and more availability of the micronutrients and the health services on a whole, and that works along for immunization as well.
Okay, birth registration is important because that's the only way you can prove that you were in fact born in Belize.
Every year, the births of approximately 9,000 babies are registered across Belize. However, officials estimate that the births of hundreds more go unrecorded annually.
I believe the challenges for registration is the distance to start with. A lot of children are born in the villages, and it's hard for them to come out from those villages to do the registration. Some people, because they want everybody to know who is their child's father, they will wait until that person is ready to register the child. If you don't have a birth certificate, then you are not, in fact, counted in population census. You are not existing, so to speak, in Belize. Even though you were born, because the information was not registered, you are not counted.
In 2011, a national birth registration drive, complete with a media campaign, was launched to make all of Belize's children visible. To date, more than 9,000 children have been registered through the program. Access to clean water and sanitation is a human right. However, access to clean drinking water and toilet facilities and poor hygiene pose significant developmental challenges to Belize.
Most of the schools, there's a lot to be desired in terms of the facilities, the wash facilities that's being provided to the students. We have 64% of the schools having adequate drinking water. Only 22% would have adequate toilets and other facilities. Definitely, without these services, it will take its toll.
The Ministry of Education has collaborated with several government departments and UNICEF to change the status quo. Initiatives include WASH, the Water Sanitation and Hygiene Education Program, the inclusion of the Health and Family Life (HFLE) education to the primary school curriculum, setting up water filtration systems in classrooms, and the construction of new toilet facilities.
The increased facilities are definitely making an impact, but along with that is also the education. The hygiene education is critical. So working in schools, working with the HFLE curriculum, and trying to work in communities at home so that the practices that are gained or are done at the school level is carried to the homes. So it's a full-scale approach to alleviating the situation. The ideal situation is a comprehensive plan for improving the facilities, and I think this is where the bigger Quality Child-Friendly School initiative takes over.
Children who go to school from an early age are exposed to so much information, so much different life skills that they need to live and survive in this world.
But such testimony has not changed social norms. Only 38% of preschool children receive early childhood education.
The foremost bottlenecks for children not receiving quality care in early childhood development will first of all speak to the awareness, will speak to the value that is placed on it by parents.
Some of our children are coming from homes where the parents are not as supportive. I do not think that it is because they don't want to support, but because they might not have the know-how, or they might not know who they can get in contact with. And that is why I would appeal to the non-profit organization and all those establishments that work with families and children to get in contact with the schools, identify the children who need the help now, and try to make a change.
What we've been doing is that we've been having regular parent education workshops with individual centers. And we don't only target the parents of the children going there, but we ask the teachers to canvass the community, look for parents, young parents, prospective parents, grandmothers or grandfathers, whoever we could reach.
Other initiatives include the implementation of an action plan designed to ensure that every child starting school is ready to learn, build stamina to attach and retain young people in schools for a greater number of years of learning, improve student achievement levels and quality assurance practices, and invest in teacher education and professional development to improve quality and create child-friendly schools.
Investment in early childhood development helps parents, helps stakeholders to understand that if you invest early in terms of stimulation, in terms of adequate nutrition, in terms of adequate school readiness, that child will have greater returns. That child will stay in school. That child will have a better quality of learning. That child will grow up to be a productive citizen.
My ideal is to see happy children, smiling children, and they're happy and they're smiling because they're nourished, because they're educated, because their families have been caring for them properly. There's been no abuse. They're being totally protected.
If we have it in our mind, if we think that the next generation is important to us, we need to start now. Because a person's character don't start forming when they're 10 years old or 13 years old. It starts down there. And parents have to learn that we are the role models.
In order for us to succeed and to really ensure the full development of children, we need to remove the barriers and bottlenecks and try to even the playing field so that all children everywhere in Belize can access the kind of support and the kind of services and they have the same rights to education, to enjoy their right to recreation and play, to enjoy their culture in such a multicultural society. The true measure of success by all that we attempt to do, after all, has got to be social well-being. It has got to be life satisfaction. What else are we living for? What else are we here for?
For more information on how you can support UNICEF's efforts in Belize, please contact us at our offices or via email.